this is slightly separate from quick. Well, it is separate from quick wins. But what are the interventions that in your experience deliver most value in health and wellbeing programs? Do you want to start, Caroline?
I think the one that I've seen have the biggest impact has been where we look at line managers. We mentioned line managers, but unfortunately we do have lots of line managers, and it's not often their fault. We've got lots of line managers in that role that we've not trained. So, we take an engineer who's great at his job and say, let's promote you to be a line manager. Now, he's probably a brilliant engineer, but may not have that emotional intelligence that he needs to be a line manager, or she needs to be a line manager. So a lot of the really big impacts in the wellbeing space at the moment, I think, are around working with our line managers to give them the skills that they need to understand how their leadership style affects their team, to understand why maybe they have issues with members of their team, because we tend to manage people in the way in which we like to be managed ourselves. But not everybody's the same. So I think equipping our line managers with that emotional intelligence and that resilience of their own is key if we move forward with wellbeing strategies, because we can put in place all the other stuff we like, the mental health first aid, the EAPs, the healthy eating, unless we're looking at that. At the end of the day, as you pointed out earlier, they're one of the key reasons why people are stressed within organisations, is line managers. And I say it's not their fault, it's because we've just not spent enough time, we've not invested enough in making sure that they can do their jobs.
And we were having a conversation before the round table started about the fact that line managers over the past 20 or 30 years have assumed so many responsibilities for things, some elements in organisations of health and safety, for performance management, for even budgeting and so on at levels where they didn't have to before. That it's not surprising if they're stretched.
No.
I think excuse me. I think part of the role is very pastoral. So. And that is about that emotional intelligence and very situational management, what's happening, how can I react to this person? And it's quite a parental role now, I think. That people in their, as you said, very true, that, often people are promoted because they're very good at what they do, but actually they're managing people becomes a whole different ballgame. And that's not because, managers don't want to do it well, it's just don't know how to do it well. So the more input and confidence they can have in how to manage those difficult conversations is always going to have a really positive impact. I was talking to a manager the other day in a law firm, and he said, I've got someone in my organisation who's really anxious in his team. Very anxious, but I don't like to embarrass her, so I send her an email every now and again checking to see how she is. And I said, why don't you go and have a conversation and just say, hi, how are you doing? It doesn't have to be that kind of formal approach. And I think that kind of, I think self-esteem and confidence for managers around actually being able to manage their people, and it not always having to be a work-based conversation either, just relationship building is really important.
It's getting it's making sure the infrastructure within an organisation supports everybody, so that everyone's supporting the line managers, that they can then do that pastoral care. It's whether it's having an EAP or having helpline, whatever it needs to be. It's making sure that it's not left to one group of people, that people are open. It's having an open, honest culture, and really just. We talked earlier about making sure people know who the mental health first aid, knowing who is there to support, whether that's internally, whether it's external partners, having an infrastructure that is there for the very best well-being of everybody.
And the peer support as well, because that's the other bit, isn't it, that people can work in a silo, and actually you've probably got a colleague who's dealing with a very similar situation, and if you talk it through you might be able to come up with a resolution for that.
We've almost got to teach people how to communicate face to face again, how to talk to someone else in the business. People have become reliant now on sending an email to someone in the next row of desks. And you say to them, why have you done that? They're over there. But then you get back to this trust issue again. It's, I need a record of that. Well, why? If you trust each other, you can just have a quick chat, and you should be able to assume that person is going to do what they said they're going to do.
I'm going to sorry, did you want to?
No.
I'm going to bring us back to because the rest of you didn't get a chance really to answer this about what you think is the best value for money interventions in a wellbeing program, because we went on to line managers as an important an important point, and fits into a kind of, we're talking really about good management, aren't we? I mean, that's it's overall good management of the workforce. But if we look at traditional well-being, health and well-being provision, we're looking at ways of measuring employees' health, the state of health and well-being to start with, and finding out whether there are any with latent conditions that might need signposting to either the NHS or a private health provider, or triaging people who've already developed conditions as MHFA does, or encouraging better lifestyles and healthier behaviour among people, diet, exercise. I'm just picking these out as the kind of components that you see in a health and wellbeing programme. What have you found are the kind of real value added options in the menu?
I think, from my perspective, my company provides affordable alternatives to health insurance, so being able to put packages that provide that both preventative and treating elements together, and doing something that fits that organisation is absolutely, that's where the value is. There's no value, if something's cheap but doesn't give any benefit, then there's no value. At the other side, you can have very expensive healthcare interventions, but being able to have a package that's affordable and that covers things like employee assistance programs, when used right, are very, very good. Having access to GPs when you're at work, so you don't have to take time off work that then brings on further stress, are great value, again, if used correctly and if used right. And things like health assessment, so you understand very much, know your numbers, if you like. So are there any themes in the workplace? We did some work with an organisation who had a very heavy smoking population, and we found that through the discussions and the health assessments. So pulled some smoking cessation programs. It is very much tailored, but you can find something very affordable, very much providing value, but you need to understand your people.
I think for me it's having different strands that run through, and each organisation will need different ones. So the management side of things, being able to maybe have themes on your intranet that link through with what you're doing in the organisation, putting taster sessions on for different things on a regular basis, lunchtime sessions, after work, things that people can try, because I think people can get very much into going to work, going home, and actually don't think they have the time to be able to explore different avenues. And I think the workplace is a great place to be able to offer people chances to have bite-sized interventions or stuff around nutrition, mindfulness, all those kinds of things that that maybe they wouldn't venture to do on their own, but actually if the organisation, the business is advocating it as something that can help them, then they're more likely to take part in that. So anything that makes it easy, really, for people to be able to access something.
I mean, I'm biased because I work in the field, but digital learning used to be called e-learning. Used to get a terrible press because somebody decided that here's a nice PowerPoint that's really wordy, and I'm going to make it into an activity you've got to click through, and that's your training done. But in terms of well-being, there's loads of resources available that you can put on a system and make available to everybody, and you can give it to them so that it's accessible at the point of need. Classroom training works, well. It gets everyone together on the same page. But what happens a month down the road or 2 months later? It gets forgotten. Whereas you put a set of resources, and this can even include things like your mental health risk assessments and things like that on there that people can do. But you make this available, it's easy for people who work remotely to access it. There are people who don't come into the office as much, or you have different, multi-sites. And once the setup cost is significant, although it isn't necessarily huge, but the cost per person is very small after that. Another advantage is it gives an organisation huge insight. So even if it's completely anonymous, you can see what people are accessing, what people are looking for, you know, what information, why are suddenly people looking up, you know, things to help them combat stress, what are we doing differently? So it can give a huge amount of insight there. So I'd say a good platform like that can offer huge value for money over long term.
Yeah.
Can we come to measurement? And it's not something we haven't touched on at all. But I think obviously, if you're in the business case part, we were talking about measuring sickness absence and then forecasting how much you might be able to cut it based on other people's experience. And obviously any kind of, you know, decile kind of change in if you've got a rate of 3 or 4% sickness absence, you know, if you can shave bits off that in any size of organisation, that does make a real difference if you're factoring in all of the costs of cover and everything. But with the individual components of a health and well-being programme, is there any way to separate them out and to work out their contribution to?
I think that's quite difficult, because I think in reality what you're doing is evaluating the strategy. So overall, the strategic approach you've taken, what's the value been, however you choose to measure that. I think when you're looking at individual interventions within that, then you're very much down to sort of anecdotal evidence, you know, feedback from people who've used the service. So it's not true data, but it's equally valuable. And I think, you know, people are quick to comment if they don't like something, but, you know, equally if they find something particularly valuable. So I think unless you do interventions in a sequence and you take measurements as you do it, you can't actually identify exactly what contribution each one's. And I don't know whether you need to. I think it's knowing that you've got your strategy right that's important for me, knowing that overall what we're doing fits with our people, with our organisation, with our culture. And we can show that in this 2, 3, 5 year period, this has been the impact.
I think yeah, absolutely. I think it's really difficult you're dealing with people at the end of the day. It's really difficult to say, well, they got that from that and that, you know. But I think if you're using it in a collaborative way, so what's working, getting feedback from people, what isn't working, how can we improve it, and you're listening, which all comes back down to the trust, then, you know, it will grow on its own anyway. I think a really good way of being able to show an impact, if you're looking at it from a people point of view, is to do case studies. You know, where were people at the beginning, you know, pick some people across the organisation and track them throughout, what made a difference to them, what didn't, and what impact has it had on them. And then you can look at that in the overall picture of everything else you're gathering. And that gives you the people aspect as well as the quantitative stuff that kind of shows you your return on investment.
I think that's the key. I think I absolutely agree with what these guys said. I think having a strategy and seeing that strategy holistically is the key way of measuring it. I think one of the key things to do is ensure that some of the bits that you start on that strategy with can see tangible benefits. Now, that doesn't have to be monetary, but actually that people can see something happening, and both employees can feel, yes, this is people management doing what they said they would, and we're moving on. And management can say, yes, something's been delivered. And that gives the confidence for people to invest more if need to, but just continue with the approach. But I think that measurement of seeing where your engagement scores go over time, for me, is good. It's like to do it in separate components. It's like doing a marketing plan with all the different campaigns. You have to see them all holistically because they don't work on their own. And I think that's how I view it.
But specific surveys, presumably apart from the kind of general engagement scores, you can do specific surveys which ask people how much has this campaign or the individual components of this campaign contributed to your sense of our being a good employer, or of have you done anything, have you changed anything about your lifestyle, have you those feel like metrics that in as much as you can measure any of it are kind of important.
It is. Now, getting feedback is really, really important, and listening to the feedback as well, which you mentioned, because a lot of employers they'll get feedback, and they do it every year, perhaps in an annual survey or something like that, but they don't listen to it. You know, they may even write it up and have a read through and say, okay, this is where we are, but are we going to implement change? Probably not. And that's it, isn't it? It's listening, and then people, if you ask people and they know they're going to be listened to, they'll tell you. You'll know what works really well and what maybe doesn't work so well, or what's valuable to fewer people. And over time, I mean, it's a strategy, so it has to constantly evolve. You know, it's a rolling thing, isn't it? You're always tweaking it and modifying it, and as long as your scores are going up in the right way.
I mean, I was working with an organisation a couple of years ago who, which is probably quite a good example of, so an organisation who thought they were doing the right thing. So one of the things they did was introduce gym membership for everybody. Now most people were based, most people were based in offices in cities, and they loved it, they valued it. You know, they could go after work at lunchtime, all of that, absolutely great. But we were doing some discussion groups with groups of employees across the organisation. We went into this warehouse. And we were chatting, and the morale was much lower in there than it was anywhere else. You could feel it as you walked in. So we got chatting and talking and trying to understand. And actually it had completely the opposite effect on them. So firstly they were saying, look, we work in a warehouse all day. We're running around. We don't need gym membership. And then it had had the opposite effect, because that had actually demotivated them, because they're saying, well, the organisation doesn't care. No, they've done this for head office and all these people who live there, who work there, but they haven't thought about us, and they haven't asked us what we'd like, and actually we'd like this. And they were coming up with just really simple things, like even like breakfast, you know, being bought breakfast once a month, or stuff that was costing nothing compared to the gym membership, but that would have made them feel valued and cared for, which goes back to this need to talk to your people, engage with your people, understand the different groups of people that you've got within your organisation.
I think that it's a really good example. I think, you know, when you're working in an organisation that has lots of different sites, or there might be national or international organisations, and I was talking to someone the other day, head of HR for Europe, and we were talking about actually having a framework but not being so specific that you miss the fact that you've got different cultures in different parts of the country or the world that will have a different way of seeing things. And if we don't take that into account, it has exactly the opposite effect to what you think it will.
And it's a demotivating effect. So it's not just, it doesn't have an effect. It makes it worse than it was before.
And I think it can bring that kind of idea of someone at head office in an ivory tower who makes a decision that's supposed to be right for all of us, and as that seeps across the business, it doesn't have the impact that people expect it to.
Yeah, if the outcome for one group of employees or one location is that it feeds a narrative that they're the people who don't really matter to the organisation, which is a narrative that can develop quite easily in other ways anyway. Then for that part of the organisation, your campaign is not just wasted; it's actually created more of what I've always called scar tissue. Is that you had the next thing you do that to encourage them and engage them has to get over their memory of something that didn't suit them at all. There's always a risk in these things, as well as and we'll come to what can go wrong in a minute. But one of the things I wanted to say was that I think that if we're talking about measurement of value, there are some very, very specific measures, even if it's on a small cohort of staff. Carl Simons at Thames Water talks in terms of the number of people in health assessment or in health checks who've been flagged up with early stage cancer and other conditions, and those are directly people who they can look at the average amount of time that those people, assuming good survival rates now, would have taken off work if they hadn't been caught that early, and some of them have never had to take time off at all except for appointments, and that's a remarkable thing for the kind of moral, the sense of moral duty of the organisation, you know, for a board or for the individuals running the programme. There's a sense of real achievement in that. For the cost of getting someone in to take sort of bloods and urine, it's a remarkable return. So I think I'd like to talk a little bit about communication. Again, you know, like everything, we touched on these things as we've gone through, but what are the best ways to pull people into a program? You were talking about sort of small bites earlier on, Alexis. Does anyone have more to say about that, about how you get people to feel good about a program, but also to take it up. There are loads of you see the number of people who don't know about their organisation's EAP still is ridiculous. The number of years that they've been contracted the EAPs. So how do you get people fully, the maximum number of people engaged?
I think Caroline's point earlier around that launch day or impact day, I think they're really critical just to get people. It's that buzz that's really important, so actually getting a real focus, a real buzz, but then it has to be many different methods, because people, like anything, people listen differently, react differently. So it's got the newsletters, intranet, lunch and learns, events. What we found works is it's like anything, competitive participation, but only if done right. So you have to be a little bit careful and make sure that that's very inclusive. Inclusivity is really important. But anything that has a competition, whether it's and the obvious ones are around slimming clubs and weight loss, or step challenges, or mindful challenges as well. I think it's making sure there is that inclusivity. But I think and link what also works from communication that we find is linking it to national awareness days. So things like November or National Smoking Cessation Week, because again there's lots of you can piggyback on a lot of the social media activity, but it's just again, and I guess found asking people, how do you want to know about this, what's important, and getting people involved. So it's myriad measures and methods, and testing and learning and trialling them as what we found worked. But there's some examples there.
And I think from a communication point of view, again, we can't underestimate the power of the board, senior people, line managers. So where people see them actually engaging with it, getting involved in it, talking about it, just generally in conversations, bringing all the wellbeing stuff into that conversation. Again, that helps keep it in people's minds, and it helps keep it in their minds that actually it's important to the business and we're important to the business.
I think businesses are very good at having a marketing strategy. So they're very good at telling everybody outside what's going on, but internally they could do with a similar thing. So we have the wellbeing days, they're already there, coming up with themes for discussion, putting it in briefings, putting it on the intranet, sending out emails, senior managers being involved. They're already doing it, but they do it externally rather than internally. So being able to kind of create that strategy of how that's going to be over the next year isn't actually that difficult, because you can map it out. There's always going to be things that might kind of interject or they might need to be more reactive to, but a proactive approach, and being able to encourage managers to be making that a priority in the team meetings and the conversations they have. I'm a great believer in word of mouth. If you put something in and it works and people like it, that is your best advert. That will spread across the team, and then the next thing you know, 10 more people out of that team want to be involved. So making sure that everything is really good quality, that it's been thought through, that it isn't done cheaply, and kind of as a tick box exercise, but actually something that people want to see an investment in and can see the impact of that on the individuals concerned.
I think you have to show that you're going to maintain something as well. So if you have a big launch, let's say you've just decided you're going to embed a wellbeing culture. You have a great big launch day. Now you need to maintain that, and perhaps it's longer than you think. But it might be 60 days. Every single day, someone from the exec is going to write something up and publish it and put something around there. It takes time to form habits. So it might even be longer than 60 days. It might be, say, we're going to do this for 90 days, every single day, until it becomes habit. And then people that come in, new people, they don't need to be told by a director that this is what we do, because the person sitting next to them will say to them, this is what we do, and this is what we do now, and that's really important as well. When you start something off, you show we're going to maintain it.
I think that's really important when you've got people in the organisation who've been there a long time as well, because something that we often hear is, oh, right, okay. Oh, we're doing that, are we? Oh, we've done this before. Oh, that manager will be gone soon, so it'll be different. So, and they're not wrong. So if you're going to do it, it has to be planned. It has to have that motivation. So even if managers change or directors change, that this is what we do, and it's an evolving programme that will always be here. So people can trust that it's going to be there and not kind of roll their eyes and think, well, it'll be gone soon, because that is what happens in organisations. People move on, things change, and someone else then comes in with a new idea and everyone kind of rolls their eyes. So, you know, it has to be something that can be seen to have longevity and is a commitment, a proper commitment.
And I think that point you made about having a communication strategy is really important. And I was really impressed recently with a client. I'd managed to get occupational health, HR and health and safety all in a room together.
That's right, it's impressive.
I think you need them all, but getting them all is quite difficult. But they actually also invited the communications director along. And that is exactly what they did, was what you described. They had by the time we left, a full communication strategy with dates. And this is what we're going to do. We're going to hit everybody with an email or a this or a that every day for so many days, and then we're going to do this, and so-and-so's going to do that, and the CEO's going to write this. It was amazing. I was really impressed and thought, actually, that's what we need more of. That's what we need companies to be doing, is really thinking about how do we communicate this long term.
Yeah, absolutely. Agreed.
So what do we, I think on the home stretch, and it's been implied in what you've just been talking about, I think, but it'd be useful to focus on it explicitly. What do wellbeing and health programs look like when they go wrong? What are the pitfalls? What are the traps that people fall into?
I would say not listening to people in the organisation, assuming that people know, senior leadership know what is wanted, and then imposing it, rather than trying to do the pre-work around engagement and communication and getting that buy-in. Really, you know, if someone tries to impose something onto somebody, you're going to have such a lot of defences that go up about that. And also not having a well thought out strategy. So the different kind of strands that we've been talking about aren't in place. So there might be a launch, but actually there's nothing to back it up. And then we fall into that kind of apathy. So it's energy really. If the energy isn't there, the commitment's not there, for me, what I've seen is that it doesn't work.
Absolutely. Just to concur with that really, I think if it's not authentic, if it's not considered, if it's just adopting somebody else's strategy just for the sake of it, it's not going to work for either the employees or management who are looking for a return. So it just falls between two stools.
I think if we think about it slightly differently as well, if we're doing things like, say, stress risk assessments, for example, as HSE suggests you should do, a pitfall of that type of approach is if you identify where the stressors are within your organisation and then you don't do anything about it, or you ask people to complete questionnaires, take part in focus groups to tell us what's wrong, and then we never get any feedback that says this is what you told us, this is what we're going to do. I think that's one really big pitfall. Another one is the sort of lack of regulation around mental health first aid and to some extent EAPs. So, you know, both of them have the potential to actually damage employees if they are used incorrectly, or if we've got somebody who's a mental health first aider or a counsellor for an EAP who's not actually appropriately trained or competent. So there are those issues as well that I think, again, we're not yet addressing. And again, it's part of compliance, part of health and safety regs that we should be making sure that any intervention we provide is fit for purpose. And at the moment, we're not auditing and evaluating EAPs. Something I used to do about 20 years ago, that people used to do that when they were much more expensive. When people paid £20–30 per head for an EAP, they would pay a consultant or a researcher to go and audit it and check it was, but now they're so cheap, they're just a commodity that organisations aren't doing it. And mental health first aiders there is no current regulation, and so they're out there in organisations, and we don't know unless we're actually helping them as organisations in terms of providing supervision and support. Because at the moment there is no supervision as a mental health first aider. You're out there in that organisation and you're on your own, and you do have the potential to cause more harm, I think, than good. Because, I mean, you said you've done mental health first aid, I've done mental health first aid, and we're very clearly told that we're signpost. We're there to signpost to other agencies, we're not there to diagnose. And I mean, I'm a psychologist, but I still wouldn't dream of diagnosing people. But there are people, unfortunately, out there in organisations who are sort of willy-nilly going around saying, oh yes, he's got bipolar, she's got anxiety, he's got depression. And that's dangerous, and really dangerous. So I think we need to try and get some sort of regulation within our organisations in terms of mental health first aid.
Yeah.
Can I just pick up on that as well? Like, I'm a psychotherapist, so I have supervision on a monthly basis. Yeah. You know, I've had years of training, and sitting with people, you know, at that point of crisis is really tricky work. And knowing what to do with it is, I'm quite passionate about this, you know, actually, you know, sometimes it's challenging for me. So if you've got somebody who's got the qualification and essentially a couple of days training, and an organisation sees that as ticking the box as being something that actually means they've done it, it's not appropriate. No. It's not appropriate for the person who's in the role of the person who's accessing that service to not have some kind of supervision in place, and also to expect that person is the person people go to with mental health difficulties. That's a really heavy role to be in without having the structure around them. It's a bit like pushing somebody forward into that no man's land and saying, well, that's your job now. And although it's not supposed to work that way, in reality, in some of the organisations, that is the way it works. And so there does need to be that, as I said earlier, is a really important part of the strategy. It's really helpful to have people who are trained in some way, but, you know, not underestimate the fact that 2 days training does not a mental health worker make. That's
something that came out quite strongly in our previous roundtable that we published in IOSH Magazine, I think. But I'd like to come back to this because, James, to give you a chance on the question of what can go wrong more generally than that, or other examples of what can go wrong.
Well, I think failing to decide what you want to get out of it at the beginning, so therefore not be able to effectively measure something. Asking people for opinions and then not listening to them, that set yourself up for failure. A lack of commitment, so starting to do something and then letting it fizzle out because you haven't embedded it properly. Letting small setbacks affect you, and then maybe you have a couple of failures, certain things don't work, and then deciding because of that this is the wrong approach. It's got to be a long-term thing. Not everything we do is going to work. I think also giving yourself enough time. So rather than say we're going to get this much done in 6 months, and then after 6 months we've only done half as much, therefore this is failing, we need to change approach. Maybe you don't, maybe you decided to do too much. Another thing that I've seen that just doesn't work is to give someone who's already got lots of responsibility just an extra piece. So you're the health and safety person, you're now responsible for mental health as well, on top of what you already do. And then you're setting themselves up for failure by doing that. And these are all things that I've seen happen.
Do we think, and this is, I think that we'll round off with this one, do you think that, if I take the devil's advocate view of the kind of cynical manager in a business, that these things come and go, there are initiatives every couple of years, and you have to implement them, and then they die off. Do we think that employer involvement in employee health and well-being is here to stay? Carolyn?
Yeah, I think so. I hope so. I think there's a lot of us out there trying to make sure that does happen. I think the more case studies we get, and the more research we get, and the more that we're able to just talk about what the benefits are, then I think really it's got to be here to stay. Yeah, sure. For me.
I think, absolutely needs to be here to stay. And I think, if you look at it from a health and safety point of view, the health part of it is now needs the attention, and millennials are coming through who want a different work-life balance, and there's lots we can learn about that as well. So I think I believe it's here to stay. I think people's well-being is something that people are now very interested in. We can see the health implications if we don't take that interest, and what that means long-term for the workforce and for individuals. So I think it needs the focus it's got at the moment, and I hope that is always there to some extent to keep it driven forward, if you like.
Sure. Helen?
Completely agree. And I think as people start to see those organisations who embrace health and wellbeing strategies and embrace that, show them to be the high-performing companies, the winners in the markets, then we'll start to see that will start to embed, because it's just good business sense.
Sure.
No, absolutely here to stay. And it I mean, I think one of the main reasons is the changing workforce. You know, I know people like to pigeonhole people into different, you know, generations. But younger people are more interested in, you know, what is this place like to work? You know, what's the employer like? Is it a good place to work? That's one of the key criteria. It isn't just how much you're going to get paid. So, you know, if you want your work, you know, if you want the company to be a good place to work, you can only do that by continuing to invest heavily, I think, in well-being.
Sure. I think that's a positive note to end on. So thank you for watching. Thanks to Carolyn, Alexis, Helen and James for participating. Just to say, this will be written up as a round table in the IOSH Magazine if you want to have it in 2 different formats. Thank you very much for watching, and goodbye.